I have got a story to tell you all today. This is the story of a 17-year-old young girl. She was in school when she got unwell. Her fever didn't break for months. Her muscles ached every day. Her parents, who were doctors, went from pillar to post to try and get her diagnosed. They had all the contacts in the medical world. They still struggled to help their child. There were times they thought they had lost her. All their years of medical knowledge had failed them. And it was only after months of struggle, wrong diagnoses, endless doctor visits, and consultations with specialists all over the globe that they finally catch what she had. And then began the painful process of treatment with all its ups and downs and new complications every day. Their hard work paid off though. 7 years later, their daughter recovered and started her MD in pediatrics. She saw the same helplessness she had seen in her parents' eyes day in and day out. Parents fighting against all odds to get their child the best care possible, yet failing. She saw children dying, becoming irreversibly blind or disabled for reasons that could have well been prevented, for reasons that 2 drops of a vitamin A supplement, 2 jabs of a vaccine, a timely referral to a tertiary care center, or the availability of resources like a ventilator could have well prevented. Reasons, most of whose prevention would cost less than the price of a hamburger. Reasons, for most of which the solutions are what you and I and every other privileged, educated human being takes for granted. Reasons which enlightened and educated individuals like ourselves consider obvious. She saw death and misery regularly. Her heart shattered into a million pieces every time. But it was only when she saw a 4-year-old die of rabies after a dog bite right in front of her eyes that she pledged to do something about it. That girl was me. I am Dr. Radhika Batra, and this is my story. A 4-year-old who gets bitten by a dog must obviously be vaccinated for rabies. That's a given, isn't it? I mean, in this day and age of modern science and technology, who would dream of not getting their child vaccinated after a dog bite? But then there was Rimi in Ghaziabad, whose parents thought that modern medicine is the devil's way, and herbs which a local doctor gave are enough to ward off any evil that might befall upon their daughter. Rimi came to our emergency room with refractory seizures and hydrophobia. It was classic rabies. She died 4 days of agonizing pain later. Children's dying or suffering lifelong due to causes we can easily prevent is one of mankind's most shameful failings. And when we Google the statistics, we realize that there are hundreds and thousands of Rimis, and the sheer magnitude of injustice in this world is heartbreaking. As many as 250 million children across the globe are at risk for irreversible blindness. And out of these, 1 million children in the world become blind due to deficiency of vitamin A, a vitamin that you and I get from the wholesome food that we have the luxury to afford. 1 million. 1 million is the population of a small city. Can you close your eyes for a second and imagine a city full of blind people, a city of darkness, a child who was born with perfect eyesight but lost it gradually? Just picture his frustration. And then imagine the opposite, a healthy child with intact vision, enjoying all the colors that life has to offer. A child who can see can live a full life, can play, run wild and free, and fly kites. But a blind child is essentially a disabled child, doomed to a life of misery. Does he deserve that? No, 1,000 times no. Specifically when 2 drops of a timely supplement could have easily prevented this travesty of justice. These children survive on meager scraps of poor quality food. They have never seen eggs, butter, or milk in their entire life. They suffer worm infestations, which make their nutritional status even worse. Their rapidly depleting nutritional reserves, micronutrient deficiencies, combined with low food intake, makes them more vulnerable to succumb to a plethora of infectious diseases, including COVID-19. Another travesty of justice that the world doesn't talk about is a child being deprived of a healthy start in life. The first 1,000 days of a child's existence are critical when it comes to physical and neurodevelopmental growth. But every year, 20 million children in the world are born emaciated and weak, of a suboptimal birth weight. This happens because mothers in countries like ours don't get the luxury of adequate rest and good nutrition required for a healthy pregnancy. The result being a low birth weight baby, prone to the devastating sequelae of intrauterine growth retardation, and a frail, undernourished mother, prone to complications during childbirth and after. These babies are prone to sepsis, jaundice, breathing difficulties, developmental issues. Many die in infancy, and many succumb to infection later on. In the long run, they are doubly susceptible to obesity, diabetes, and other lifestyle diseases, overall adding to the health burden of the world. Now, coming back to me, my illness lasted for a decade. It was a decade of uncertainty, ups and downs, traumatic and painful investigations, terrifying side effects of both the medicines and the disease. But I could really understand what illness is all about, what it means to be sick. And then in 2009, I joined medical college. While in medical school, I realized that I'm in a unique and privileged position compared to other doctors because I have traversed the road less traveled, the road that most doctors never get to travel. I have been on the other side, so to speak. So my empathy for my patients is a million times more than what it would have been otherwise had I not had the illness. Very early in my medical career, I realized that there is no doubt that there are many ailments that we can't prevent. There are cancers, there are genetic diseases, there's Down syndrome. But what about those that can be prevented? What are we doing to prevent these, especially in children? Which brings me to the point. Let us all work together towards a common goal. Let all stakeholders combine, governments, health specialists, NGOs, international agencies, everyone. Who was it who said that an ounce of prevention is worth a pound of cure? This dictum must be accepted as the golden principle of healthcare. Prevent, prevent, and prevent. Give nutritious food. Give supplements to children and pregnant women. Promote breastfeeding. Step up immunization. Deworm children. Get rid of harmful myths from the community and bring about a behavioral change in the mindsets of people. If we can achieve the above, illnesses will become less. Infant and under 5 mortality will go down. Maternal mortality will go down. It's simply a case of a stitch in time saving 9. And I personally believe that low-cost, timely, effective interventions where a small amount of investment can lead to a great and enormous social return on investment is what we're looking for. Another interesting part of my illness was that I could see firsthand the effect it had on my parents and siblings. I was a keen observer. I observed many kinds of reactions: panic, acceptance, fear, denial. There was a day my mother said to me, "I wish I would have got the disease instead of you." And in that moment, I realized how much my parents had suffered with me. And now, when I meet the parents of a sick child, I know exactly what they are going through, and kindness simply bubbles over from my heart into theirs. When I was sick, sometimes I was very angry. Why do I have to suffer so much? Why did God choose me for this suffering? I couldn't bear the injustice of it all. But now, I'm glad that it happened. I have accepted my chronic illness as a gift from God and used it as an opportunity to learn and serve those in need. After all, what you leave behind is not what is engraved in stone monuments, but what is woven into the lives of others. Mahatma Gandhi once said, "Be the change you want to see in this world." And to all of you who have patiently heard me speak today, I just have one parting message. Give up the apathy. This is your country. This is your planet. No one from the outside will come and clean it up for you. If not me, then who? If not now, then when? You are not too young to lead. You are not too old to learn. Get up, stand up, make a difference, make the future. Thank you.